just drinking too much and flipping over to developing liver disease. So really, it's drinking above a threshold. And what is the threshold? So for women, it's 1 standard drink per day, and men, it's 2 standard drinks per day. So what is a standard drink? Now that's 14 grams of alcohol. And I don't think anyone ever measures alcohol based off the grams that they drink. So that's why I want to include this kind of cartoon right here, where it talks about a standard drink is a 12-ounce beer, 8 to 10 ounces of malt liquor or malt flavored drinks, 5 ounces of table wine, 3 to 4 ounces of kind of like those sherries or port wines. If you're having other liquors, it's like 2 to 3 ounces, 1.5 ounces of brandy or cognac, or 1.5 ounces of shots. So of gin, rum, tequila, whiskey, of that sort. So for women, it's really 1 of these drinks per day. For men, it's 2. So when you go past that threshold, you are running a risk of developing liver disease. And of course, the pattern of consumption, that daily drinking while fasting, and binge drinking also increases the risk of alcoholic liver disease. So some people don't have to be drinking every day, but if they consume more than the standard, that would kind of be spread out over a week or on the weekends or something like that, that can cause an issue as well. Of course, smoking cigarettes also increases that risk. The risk is higher in women than men, rather, because we know the women have a lower tolerance for this. Now, we know about 40 to 60% of liver disease, just alcohol use disorder is based on genetics. And the genetics we're talking about here are several things that we can't technically test right now. It's kind of just more research side of things. But these are genetic markers that people can have, because I often get the question, Doc, I get it, I drink too much, but why I'm drinking with my buddies and why am I the only one with liver disease? Well, they're fine. Well, because we know that there is a genetic risk to this, and they may have other issues as well if they're smoking or if they have a greater body mass index, they're overweight or obese, and of course, if they have what we call comorbid condition, other liver diseases that are a problem, such as viral hepatitis, hepatitis B, and hepatitis C. And we know here in DC, DC has the highest rate of untreated hepatitis C in the country. So when someone has that and they're drinking above the threshold, they're going to develop liver disease at a faster rate or at a higher rate. And then metabolic disorder associated liver disease, that's a new term that we used to use for fatty liver disease or non-alcoholic steatohepatitis. We know when someone has that quote unquote fatty liver from non-alcohol, there really is no safe amount of alcohol. We'll touch on that as well there. But I think the big thing here to take home here is this slide right here, and showing how much people really should be drinking if they want to avoid liver disease. Now, however, the caveat is once they have liver disease, there's no safe amount of alcohol.